Welcome to our channel. If you need to enroll in health insurance during open enrollment, follow these step-by-step instructions to choose the best plan. Step 1. Mark your calendar for the open enrollment period. For marketplace plans, this typically runs from November 1st to January 15th, though dates vary for employer and Medicare plans. Step 2. Gather information about your household, including income, family size, and current insurance coverage. You'll need this to determine eligibility for subsidies and compare costs. Step 3. List your current medications, doctors, and expected healthcare needs for the coming year. This helps you choose a plan with appropriate coverage and in-network providers. Step 4. Visit healthcare.gov or your state's health insurance marketplace to browse available plans. Enter your information to see plans you qualify for and potential subsidies. Step 5. Compare plans based on monthly premiums, deductibles, copays, and out-of-pocket maximums. The cheapest premium isn't always the most affordable option overall. Step 6. Check if your doctors and preferred hospitals are in-network for plans you're considering. Out-of-network care costs significantly more or may not be covered at all. Step 7. Verify that your medications are covered under the plan's formulary. Look at both coverage and cost-sharing tiers for your prescriptions. Step 8. Enroll before the deadline to ensure coverage begins January 1st. If you miss open enrollment, you can only enroll if you qualify for a special enrollment period due to life changes. Don't forget to like this video and subscribe to our channel.